The Lumenergetics Health Protocol, Health and Balance for Chronic Illness and Immune System Dysfunction. Order of procedures. Protocols within this order may be modified by an experienced health professional so that timing, duration, and intensity of therapy may conform to individual needs. Evaluate disease state. Conduct a full assessment using the Lyme disease individual strains test kit and the Lyme disease co-infections test kit. Polarizing. Using a polarization technique, such as lining up the knuckles of the subject's hand along the midline, just above their navel, may help with detection of illnesses to which the immune system has become deactivated. Evaluating for encephalitis. Test for encephalitis viruses directly at the brainstem while polarizing, as the immune system often deactivates from fighting these viruses and they may escape detection. Assess illness cofactors: toxic mold home or work environment, geopathic and electromagnetic stress, relational and emotional stress, spinal subluxation and atlas misalignment, allergies and sensitivities, eating habits, exercise routine. Toxic mold home or work environment. Hire an experienced remediation service with good references, if possible. Most chronically ill people will need to move out of a moldy house they got sick in to get well. Geopathic stress. Assess for reactions to living over fault lines, underground rivers, landfills, or other geological instabilities. Use a homeopathic geopathic stress remedy if indicated. Move to a new location if necessary. Electromagnetic frequencies and radiation. Sensitive patients may need to avoid cell phones, cordless phones, computers, wireless devices, electrical cords under the bed, and living in very close proximity to cell phone towers. They may also need to turn off circuit breakers to their bedroom at night. Relational stress. Seek counseling with an experienced marriage and family therapist. Refuse to engage in abusive interactions or relationships. Emotional stress. Consider using psychotherapy, craniosacral therapy, EFT or MFT tapping techniques, and Bach flower essences. Spinal subluxation. Seek experienced chiropractic care. Atlas misalignment. Seek chiropractic care with a chiromat, NUCA, or other doctor of chiropractic specializing in C1 alignment. Allergies and sensitivities. Conduct a full energy test evaluation for food allergies and sensitivities. Avoid such foods entirely or use a rotation diet, eating them only every 4th day, or use Lumenergetics PE1 desensitization technique. Sensitivities may self-correct when healthy gastrointestinal milieu is achieved. Eating habits. Eat an organic diet whenever possible. Choose mainly fresh vegetables and lean meats, legumes, complex carbohydrates, and fresh fruits. Avoid simple carbohydrates, especially when dealing with candida, molds, or other fungals. Avoid prepackaged foods, and take digestive enzymes if necessary. Exercise and movement. Exercise with gentle weightlifting for full body motion 20 minutes every other day. Do full range of motion exercises without weights and from a seated position if necessary. Avoid aerobic activity until symptoms are reduced. Biofilms are a sticky substance secreted by many infectious organisms to provide a hiding place from the immune system. Begin biofilm eradication and maintain as necessary throughout the course of wellness therapy. Detox and drainage. Begin detoxification support using near-infrared light with companion vial set detox and drainage support vials. Refer to the website for instructions. Bee venom ointment contains melatonin, shown to kill spirochetes in laboratory research. Individuals with Lyme disease, MS, and/or rheumatoid arthritis often respond well to bee venom ointment. Mercury toxicity. Remove dental mercury amalgam fillings. Make sure the dentist uses a rubber dam technique. Evaluate root canals for any possibility of infection. Root canal teeth may need to be removed in cases of chronic illness. Detox and chelate mercury. Macroparasites and worms. Remove macroparasites from the body. Check all organs, especially liver and lymphatics. Macroparasites may inhibit enzyme production and may harbor microorganisms. Deworm using a sea salt and vitamin C. Assess for bacterial infections and nanobacterium throughout parasite die-off process. The sea salt and vitamin C protocol. 1.5 grams of sea salt per 20 pounds of body weight in 4 divided doses per day for 3 weeks. With each dose, also give 1 to 4 grams of vitamin C. Ramp up to this full dosage slowly. Blood pressure should be monitored and not elevated outside acceptable levels. A small percentage of the population are salt sensitive and may react with significantly increased blood pressure. Monitor carefully. Nanobacteria. Parasitic worm die-off may be associated with increase in nanobacteria. Reevaluate and address nanobacteria with near-infrared and signature vials, along with supplements if necessary. Nanobacterium protocol may be especially beneficial in cases of arteriosclerosis and/or kidney stones. Protozoa. Protozoa and other microparasites may tend to respond well to parasite worm protocols. In addition, Giardia may often respond well to long-term use of freeze-dried garlic. Babesia may often respond well to artemisinin, taken with grapefruit juice, 1 week on, 1 week off. Genetic vulnerabilities. Assess for insufficient methylation and/or sulfur accumulation. Use appropriate supplements to improve detoxification. Use Lumenergetics sulfur detox vial and protocol 2 to 3 times a week. Vitamin sensitivities. Correct for any sensitivities to B vitamins, vitamin C, magnesium, molybdenum, and manganese. See the Lumenergetics desensitization protocol. Adrenal stress. Use Adrenalume companion vial and supplements as needed and as indicated by energy testing for increased energy and hormone balance. Continue as helpful throughout wellness recovery. Scars and interference fields. Correct as needed with near-infrared light and/or prolotherapy. Depression and anxiety. Pulse settings A, C, and F may be used on the forehead and base of the skull for symptom relief. Use 2 times a day on level 2 for 10 seconds each frequency on each point. Continue throughout the course of wellness therapy as needed. Viruses. Begin using Lumenergetics therapy vial sets with PE1 for viruses. Evaluate carefully and locally for encephalitis viruses, as the immune system may become deactivated in response to them. Viral meningoencephalitis may be implicated in cases of pituitary adrenal axis malfunction and hormone dysregulation. Fungals, molds, and candida. It is usually beneficial to move away from home or job that is causing toxic mold and mycotoxin exposure. It is difficult or impossible to get well in a mold-contaminated home where you got sick. If moving is impossible, hire careful, experienced remediation of molds and mycotoxins. If moving, decontaminate all belongings with industrial-level ozone. Restrict all simple carbohydrates and sugars from the diet. Candida and fungals should be treated in conjunction with mercury as they are synergistic. Fungals release mycotoxins into the body with die-off. It is essential to follow a serious neurotoxin detoxification regimen when addressing systemic fungals, or the patient will get much sicker. In cases of persistent candida or systemic mold, high mercury levels need to be addressed. Bartonella. Address Bartonella as the initial bacterial organism, especially when indicated by energy testing. Use isolumen K set for Bartonella strain. Bartonella appears to produce a chemical that shuts down immune system response to other organisms. Lyme Borrelia. Lyme borreliosis appears to be rampant, and most Americans seem to have been exposed to it, with a variety of symptomatology at varying intensities. Lyme disease is a serious illness due to Borrelia infection. Refer to the PDF Light Therapy Treatment Protocols on Lumenergetics.com for using Isolume K therapy set with PE1. Treatment is considered complete when none of the organs, lymphatics, teeth, or jaw test energetically for Lyme below 1000 K. Re-evaluate every 6 months or after times of extreme stress, and retreat if necessary. Lyme Borrelia produces potent neurotoxins that must be absorbed and eliminated from the body with specialized nutritional supplements. It is essential to follow a serious neurotoxin detoxification regimen when addressing systemic Borrelia, or the patient will get much sicker. Lyme disease and mercury. Patients with chronic Lyme disease often have high levels of mercury. Chelating mercury may make healing from Lyme and preventing reinfection much easier. Lyme Borrelia bonds with mercury and may release mercury into the body when it dies off. Remove as much mercury as possible from the body when treating Lyme. Mercury will recirculate through the body and may do serious neurological damage unless bonded to chelating agents and removed. Mycoplasma seems to be a causative factor in many cases of rheumatoid arthritis. Mycoplasma may respond well to enzymes. Autoimmune dysfunction. Borrelia, Mycoplasma, and other L-form or cell wall deficient bacteria seem to be responsible for many cases of rheumatoid arthritis and autoimmune dysfunction. Cell wall deficient organisms enter host cells and may cause the immune system to attack the host tissue. Autoimmune dysfunction. Microparasites, such as Babesia and some protozoa, also enter host cells and may cause an autoimmune reaction. Bacterial co-infections. Address Rickettsia, Ehrlichia, Brucella, and other bacterial organisms as they show up in priority order. Use isolume sets with near-infrared light. Reassess for Mycobacterium TB and bovis, as they are virulent and fairly common with severe immune dysfunction. Also, reevaluate for Klebsiella, especially of the oral cavity and GI. Address strep infections concurrently with herpes infections if needed to fully eradicate. Muscle reactivation. Use near-infrared on acupuncture points for muscle reactivation. Technique is appropriate for muscles that have been deactivated due to autoimmune disorders and traumatic injuries and athletic injuries. Thank you for visiting. Find us at www.lumenergetics.com or contact us at lumenergetics@gmail.com.